Let's 708. We'll get Lillian Posadas from the Guam Memorial Hospital on. Good morning, Lillian.
Good morning.
Good morning.
Hi. Hi. So I don't know if you heard Uncle Carl there, but he's back on. Well, he's been on the team, but he's back on the field.
No, I didn't hear your talk with former Governor Calcaterra. Sorry.
No problem. Good. Well,
She's busy.
I'll send you the link on YouTube later.
All righty. Okay, sure.
So, Lillian, just kind of want to catch up with GMH here. So what is the latest now that we're in P-Core 2? How has that kind of changed up you guys' status as the COVID hospital?
Because you kind of dropped off, I didn't catch the first part of your comment.
So we're in P-Core 2 now, and we're just wondering, has that led to any operational tempo shifts at the hospital?
Well, we're seeing an increase, we're seeing individuals coming in to the hospital who are COVID positive, where for several days we were 0. And so today's Friday, late Wednesday night, early Thursday midnight, we had 2 individuals come in. And then yesterday afternoon at 12 noon, another individual came in COVID positive. So, yeah, it's a slow and a low increment, but still it's a concern because people are out there, they're out congregating, they're out shopping, they're out. So it's a concern for us.
Mm-hmm. You said COVID positive, so that you said 2 the other day and then 1 today.
1 yesterday.
Yesterday, yeah.
Yeah, Wednesday night, midnight, 2 individuals came in and to ER and they were tested. 1 was already confirmed from a visit at the other hospital, GRMC, and so he came in to the emergency room with his adult, caretaker or a grandfather.
Right.
Parent.
Lillian,
Right.
So we had heard from some sources that this was a grandfather and a grandson. Are you able to confirm that?
Correct. Yes, that's confirmed.
Oh.
Those are the 2 that came in Wednesday night, midnight, and then yesterday afternoon, another adult came into our emergency room who was initially seen also at GRMC and was tested, and so was referred to GMH. So he arrived at our doors in the afternoon yesterday.
What kind of condition are these COVID positive patients in?
They're stable. They're stable condition.
Do they have comorbidity issues?
The young individual that was initially seen at GRMC, he's a young individual, so he was symptomatic with a fever, and so the grandfather was asymptomatic, but because of the exposure, bringing his grandson to GMH, the doctors then thought that it's best to just also test the grandfather. And so I don't know the exact age of the grandfather, but the age is a factor.
Mm-hmm.
That age is a high risk as far as for the elderly people.
So Lillian, when you say they're in stable condition, are you telling us that these 2 COVID positive patients are hospitalized?
The 2, the grandfather team they were released yesterday from our emergency room to the government-sponsored COVID isolation facility. The 3rd individual, the other adult, he's in our hospital being monitored.
What can you tell us, as we had another tip about, and I don't know how in the loop you are with what happens over at GRMC, but did you hear anything at all about 5 presumptive positive patients at GRMC?
No, that I did not hear. I did not get that information.
Okay.
Mm-hmm. I just find it interesting that you're saying there were 3 positives when the releases that we get from the Joint Information Center don't match.
Well, because remember that they get their information from public health, and the public health, when they give the information, it's the results of the day before. So the 12-year-old who was seen at GRMC reported that result. So that was already reported as the 1 positive test. Then yesterday, midnight, and public health was not open. So for us, we reported 1 when that guy, the grandfather, was tested. The other individual, again, was tested by GRMC. So I don't know. I'm sure GRMC reported that to public health. So may have been reported yesterday. I don't know. But, when public health gets the results, that's when they report it the next day.
Right.
Mm-hmm. Yeah, it still doesn't add up, but, we can...
I know. I mean,
we can talk with, I guess, public health or the
Linda.
Joint Information
Right.
Center.
And then Linda does her report, the cumulative report for the day before.
Yeah.
Right.
So,
No, I'm looking at it with that mindset, with the day before
Right.
reporting,
Lillian,
and it just doesn't add up.
I know you're not a contract trace investigator or contact trace investigator, but in talking with this grandfather and this grandson, what were you able to find out about how they believe they contracted COVID, or how they were exposed under what type of conditions? Were they at a gathering or?
That I don't have that information, Chris and Sabrina. I don't have that because this was all kind of yesterday afternoon that I was getting more information about the grandson and the grandfather, and so I will talk to our infection control team and get more information as far as I'm assuming they came from the north because the 12-year-old went to GRMC emergency room because that's the closest, I guess, facility that they could then access. Particularly because the individual was manifesting fever. Mm-hmm. So, that was the quickest health facility that they could get treatment.
Mm-hmm.
You sounded pretty concerned at the beginning of the phone call when you were saying that people are out there gathering, people are out there shopping, and then you'd mentioned these 3 cases. So I'm kind of wondering, do you think that the gradual reopening of the island has led to conditions where we're going to see more positive patients?
I'm not sure that I can't say, for sure that is that's what's the causative factor, but we're just looking at data. For several days we were 0. Test results, and so now we're seeing some uptake. 1 a day, 2 a day. Total, as of yesterday, there were 3 cases. So, there may be some correlation. I can't say that because the numbers are small. But like I said, it was 0 for several days, and then people are now out and about. The stores, the malls are open, and I hear. But although the stores and many businesses are enforcing social distancing. But there are other, locations where people are gathering, more than 10 people are gathering, such as the beaches. I hear there was a report that there was a, gathering at a beach of more than 20 people.
Right.
We just need to make sure that we really enforce and we really promote the social distancing and, minimize the congregation of people, and just be more concerned about it and more cognizant and practice it. We really don't want to see a second wave of this COVID infection.
Yeah, we definitely don't. I wanted to follow up on something. The last time I believe you spoke with Nestor Lecanto was about this the possibility of applying for a loan under the CARES Part 2 or Part 3. It was when they announced, the president signed the law regarding the second phase of the PPP.
Right. We received that information, and our acting CFO took a deep review of the qualifications, the criteria. And yes, this is the first time government hospitals are eligible, are made eligible and qualified for this Paycheck Protection Program through the SBA. One of the qualifications is that the facility, the government hospital, employs less than 500 employees, and so that we don't meet that qualification. We're more than 500 employees as a government hospital.
Oh, so you wouldn't be able to apply.
That's what the conclusion is, and that's the decision we made, that we don't meet the qualification, therefore we didn't apply for that PPP program under the SBA CARES Act.
Okay.
Lillian, we wanted to ask where you are on the double pay issue. There is, I'm sure you're well aware, we had nurses and healthcare workers that take to the streets holding signs, picketing.
Yeah, they're members of the GFT union, and so, yes, GFT union is pursuing that for the employees, but, from my own perspective, it's not practical. It's not prudent. It's going to bankrupt the hospital. We cannot afford double pay. So I don't agree with it. The executive order that the governor had established for COVID differential pay, the three categories of 25%, 15%, and 10%. The staff, in talking with the staff, they're very satisfied with that. The concern they have is that, other agencies such as GPA and GWA, they got double pay, and they don't think that, that, because the hospital is the one that deals with the infection directly, not GPA and not GWA. Granted, when that personal rule was established many years ago, it was for a disaster, such as typhoons, such as storms, and GPA technicians are out there in a high-risk situation where they could get electrocuted and instantly die. So maybe that at that time, it was considered appropriate that they get the double pay. But in this kind of a disaster where it's a communicable disease, we pretty much are prepared to then minimize the transmission of the infection. So it's not the same kind of a disaster. And with the ruling, with the opinion of the AG Attorney General, I think it's very, very practical, very prudent what he came out. It doesn't apply.
Mm-hmm. If you could pay the double pay, if you did have the finances to do it, would you?
But I mean, again, it's not just the nurses. It's for all GMH employees double pay. And so not every employee in the hospital has direct contact with the COVID patient. So, is it fair that they get the double pay as well as the nurses and the doctors and others who are in direct contact taking care of the COVID infected individuals? I don't think so. I mean, again, we have to be prudent about this and practical. And follow the executive order. But, I mean, if I'm in my office as an administrative staff and I don't have direct contact with a COVID patient, should I be getting that double pay?
Are you getting differential pay?
No, ma'am. I decline getting that differential pay because it's, I rather that the staff who are indirect or possibly incidentally, in contact with the COVID patient, they're the ones who deserve that, not me.
Wow, that's refreshing to hear, especially considering that we have other cabinet members who were getting catered meals and differential pay working at the quarantine facilities. That's Lillian, it is what it is, but I just got to commend you because I think that's a good display of leadership that, hey, you can get this extra money, but you're like, no, I'm a manager. I don't need it. It's cool.
Well, again, this is the responsibility we have to uphold as a standard that, it's not about us. Not about it. It's for the people.
What can
for the staff.
What can we find out about the SNU? Because it kind of seems like we never really got a clear picture on if it was ready to be used, if we were using it for COVID, if we weren't, and then can we just go into the SNU?
The status of it.
Sure, absolutely. The SNU, we used it for several weeks for those COVID positive patients who then transitioned out of the acute care setting at GMH. But they still need to continue being in an isolation and monitored because at the time in the beginning these individuals can crash any moment. Their condition can deteriorate really quickly. So that's why that step of an SNU isolation facility with staff, nursing staff, and doctors where they're monitoring those patients 24/7. When we went down to zero or even just one patient, we decided that it was not cost effective to continue operating that facility. So we put it on a stand down and moved those employees from the SIF, we call that SIF because it's the COVID isolation facility. We moved those employees then to the acute care side, and the facility is ready anytime that we need to then open it up for more patients who need isolation, continued isolation and monitoring. But it still is on a stand-down mode, but anytime it's ready to be opened up again if we need to.
I know that I spoke with Claudia Kfaji, the Chief Procurement Officer, yesterday, and she said that they had done a site visit over there to SNU. Right. Can you tell us about that?
I don't know. I wasn't present at the site view. Mr. Kandu, our social administrative operations, was there, was present, and so I can't say much other than the facility. We maintain security, so nobody will tamper with it. The chiller, which is that runs the air conditioning unit. It's just interesting that the day Wednesday we put it on stand down. That week, Friday night, the chiller went down. It's an old chiller. It's over 25 years old. We've been planning to, get it replaced. It's just that financially we didn't have the means at that time to get it. But we went through the process of an RFP, and so right now the Guam National Guard has provided us temporary portable, blowers to keep the facility, cool as much as possible. And we are in the process also of getting a loaner of a 145-ton chiller. And at the same time, we have a contractor who's going to repair so that it can run temporarily while we go through the process of the RFP, completing it to procure and replace that old chiller.
Well, Lillian, it sounds like you guys have some money. Did you guys get any federal money as a result of COVID-19? And how much and what else are you going to do with it?
Well, we received $4.5 million from the Medicare Advantage Advance program. We applied for that and we received 4.5. We received another $965,000.
Whoa.
I was going to say, wow.
I know, right? That would be great.
Fix the roof, fix the panel, fix the elevator.
Build a couple of hospitals.
No, we're going to build a new hospital with that.
Yeah.
But the $965,000 was the first distribution of that $30 billion that was earmarked for under the Department of Public Health and Social Services Emergency Fund. We received $965,000 from that first distribution. We received another $2 million from the $20 billion disbursement, and then another $5 million that's coming from the Rural Health Provider Fund, CARES Fund. So yes, we do have some funding now. We're paying our vendors that we need to pay, and so we're diminishing our accounts payable because we're paying our vendors.
Well,
So that's about a $12 million, right? Roughly.
About 12 million, yes.
Lillian, what can you tell us about? This is something we've been kind of trying to track down. Is the Perlis Court, where the 17 fully furnished condo units that we're being told used for the medical staff. Right? Can you tell us about that and who was staying there, and is that still available?
Yes, it's still available. We started that service, that accommodation and lodging for the medical staff, specifically those who we assigned over to the CIF, the COVID isolation facility at SNF. So all the staff, all the hospital staff who are assigned to operate the services there at CIF, they were initially assigned there. This again as a secondary layer of safety and as protection for the staff who are directly exposed to those COVID positive patients. So that way, it gives them assurance that we're minimizing the spread of the infection, particularly for them to go home to their families. And so we offered it. Some of them took up the offer. Some of them decided to just go home. And that was ever since March 14, I believe, or March 13. So we continue to occupy that, and we have moved those who are from the acute facility, GMH, who were at Windham. So then we made that accommodation for the acute care staff, to give them that secondary layer of protection, infection control protection. We moved them out and put them over at Perlis Court. So Perlis Court is fully occupied by our medical staff. Just to continue giving them that additional assurance of protection, and infection prevention before they go home.
Right. How does that work logistically with the 17 fully furnished condos? Is it one staff per condo, or are they kind of bunking together?
They're bunking together, yeah. Right.
And you said they're still there?
Yes, ma'am. They're still there because we're still seeing COVID patients at the acute facility. And so, yes, they're still there. The contract, I understand, is up until the 18th, which is Monday. So
So
Wow.
they'll be moving out, or do you know if it's going to
Either-
be extending?
either they're going to be moving out or it might be extended. I haven't yet. I have an ops meeting this morning with the governor's team, and so we'll
Right.
find out.
Well, we spoke with Charles Estevez, the Civil Defense Administrator, yesterday, and he seemed to indicate that once these contracts run out, they're going to go back and do the procurement the proper way, because apparently the first time, well, I'm pretty sure you watched the news.
Yeah, but I won't comment because that's not my jurisdiction.
Stay in your lane, Lillian.
I'm staying in my lane, doing what I need to do.
Right. All right. Is there anything else you wanted to say about what's happening over at the Guam Memorial Hospital?
No, but again, we just want to reinforce and reinstate. People, please take this very seriously. To respect and promote the social distancing, the face mask, the hand washing, those practices, so we
Right.
can really maintain and contain this condition and not see a second wave.
Right. And just real quickly, with that $12 million, you said that you were going to use some of it to pay. Did you say vendors?
We're paying, yeah. Or we're
Okay.
using it to pay our vendors, absolutely.
And anything else that you were going to be using it for?
Well, we've got some projects, CIP projects that we've been wanting to do, and so, yeah, like that chiller, we need to get that chiller done, taken care of over at SNF. So, well,
Anything else, like the elevators or
The electrical panel, the
yeah,
roof?
yeah.
that's definitely possible, but the elevators are all repaired. They're up and running, so we got that taken care of. We've got the air conditioning units throughout the hospital, 61 units that need to be replaced. So that, again, is also another project. But yes, the electrical panel, we want to address that, because even though the plan to build a new hospital, we still need to operate that facility another 5-7 years while we're waiting for that for the construction of a new hospital to be completed. So we want to make sure that we don't nothing happens with the electrical panel. We want to take care of that.
Lillian, I don't know if I missed it. Visiting hours, have we done anything with the visiting hours now that we're in peak
We're
too?
still restricting it, Chris and Sabrina, because again, we're trying to make sure it's for the protection, the health and protection of the community. And if we start allowing the visitors, that's going to increase the traffic into the hospital, and that's just going to, again, increase the potential for spread of infection.
Right.
So, but we're looking at it, and if we continue to stay 0 to 1 COVID case, maybe we can allow at least one visitor. And we do take it on a case-by-case basis, because there are some individuals who, like the parents, pediatric patients, we
Right.
allow one parent to
Of
be
course.
the patient. Yes.
All right. Thanks.
Thank you, Lillian, so much. I
Thank you,
appreciate it. And we just kind of want to get you on every week, just do an update, and that's cool, right?
Yeah, that's cool.
Okay.
I have nothing to hide.
Okay, thank you, Lily.
All right.
Take care.
Okay, Steph.
You too.
Wash your hands.
Take care.
Okay,
Okay.
bye.
All right.
Okay, well, that was interesting.
That was. What was the interesting part to you, Sabrina?
That there are 3 COVID cases from the Guam Memorial Hospital.
Let's look at the results that we've gotten the last couple days from the Joint Information Center, Sabrina, and see if they match up with.
They don't match up.
They don't
They don't.
match up.
They
Why
don't.
wouldn't they match up, Sabrina?
Because the numbers don't match up, Christopher.
Yeah, it's,
Like for yesterday it was 1, but that was 1 from public